Good day, everyone. Welcome to SmartSpark Academy. Please, if this is your first time coming across our videos, do well to like, subscribe, comment, and share with your friends. Now, we are going to look at a very interesting anatomy topic, which is the axilla. It's a very common topic that comes out in exams, class tests, and all of that. So, if you know that's what you're looking for, sit back, get your book and your pen as we learn together. Talking about the axilla. Now, the axilla is commonly known as the armpit, but in anatomy, we cannot call it armpit, we call it axilla. Now, under this topic, we'll be looking at description, shape and size, boundaries, contents, and the clinicals. So now the first thing we'll look at is the description of the axilla. How do we describe the axilla? What is the axilla? Now, the axilla is a pyramidal space inferior to the glenohumeral joint. Note that the glenohumeral joint is the shoulder, inferior is below, down. Now, it is inferior to the glenohumeral joint and superior to the axillary fascia at the junction of the arm and the thorax. Your arm and your thorax. That's the axilla. Pyramidal space. Where is it located at? Inferior to the glenohumeral joint, which is the shoulder, superior to the axillary fascia. Let me give you a quick diagram, just something simple to describe this axilla. Now, this is a rough sketch of the shape of the axilla. Don't forget I said it's a pyramidal structure or space. Now, we are done with the description. Look at the shape and size. Shape, pyramidal. Now, size. I want you to note that the shape and size of the axilla varies depending on the position of the arm. Now, when your arm is abducted, fully abducted like this, the axilla almost disappears, and its contents, the content of the axilla, they are most vulnerable in this position of abduction. Not at the contents of the axilla, we'll get to it, but I just want arteries, veins, and the rest to ring in your mind. And also, the axilla serves as a passageway for neurovascular structures that serves the upper limb. We'll look at the boundaries of the axilla. We are going to use this rough sketch to explain that. Okay, let me do a quick labeling of this so that I'll explain with that. Now, on the boundaries of the axilla, as you can see, this is well labeled now. We have the apex, we have the base. Apex, the tip, the up part. We have the base, which is the down, the part below. We have the medial wall. You know that in anatomy, medial is the part or the section closer to the body. So medial wall is the wall that is closest to the body. We have the lateral wall. The lateral wall now is the wall away from the body. Medial close, lateral away. We have the posterior wall. Posterior is back. Posterior also is the wall at the back of the axilla. And lastly, we have the anterior wall, which is the wall at the front, like the surface of the axilla. So we are going to discuss about these boundaries, each of them one after the other. Now we'll start with the apex. Now, apex, as you can see, is a circle. So it is called the cervico-axillary canal. Now, this place, when you see this circle, just know it's a canal. It's the cervico-axillary canal. When you hear a canal, it's like a passageway. Just remember that the contents of the axilla pass through this canal. The lymph, the lymphatics, the arteries, and the veins, they pass through this canal. Now, this apex is formed by the superior head of the scapula. You know the scapular bone, which is the shoulder blade. It is formed by the superior head. It's formed by the clavicle. This is your collarbone, and it's also formed by the first rib. So the three bones that form the apex of the axilla are the superior head of the scapula, the clavicle, and the first rib. Now, we'll look at the base. We've talked about the one above, which is the apex. Let's look at the one below, which is the base. Now, note that the base is formed by concave skin, subcutaneous tissue, and axillary fascia. Now, this axillary fascia extends from the arm down to the thorax and to the fourth rib. So don't forget, the base is formed by concave skin, by subcutaneous tissue, and by axillary fascia. With that, we've talked about the apex and the base. Now let's look at the anterior wall, the front wall. What forms this front wall and what is its function? Now the anterior wall, which is the front wall, as I've said previously, the anterior wall of the axilla is formed by muscles. It's formed by the pectoralis major muscle, it's formed by the pectoralis minor muscle, it's formed by the pectoral fascia and the clavicle pectoral fascia. I've mentioned four important things that forms this anterior wall. Please take note of that. Now, a very important thing to note in this anterior wall is the anterior axillary fold. The anterior axillary fold is the innermost part of the anterior wall that can be grasped with the fingers. Now, note that it is the innermost part of the anterior wall, that can be grasped with the fingers. It is formed by the pectoralis major muscle that as it bridges between the thoracic wall and the humerus and also the overlying teguments. That's that on the anterior wall. We move to the posterior wall. Just when you're describing the anterior wall, the front wall. We're looking at the posterior, which is the back wall. What muscles form the posterior wall? Now let's look at the muscles that form the posterior wall. As like I said earlier, posterior is the back. Now remember that the scapula is found at the back and is at the region of the axilla. So let's relate it with this posterior wall. Now this posterior wall is formed by the scapula and by the subscapularis muscle. I've mentioned two things. The scapula and the subscapularis muscle at its anterior surface. Then inferiorly, like if you go below, it's formed by the teres major muscle and the latissimus dorsi muscle. So it's formed by three muscles and one bone. The scapula and subscapularis, latissimus dorsi muscle, and teres major dorsal. The same way the anterior wall have the anterior axillary fold, the posterior wall also have its posterior axillary fold. Now this posterior axillary fold, it's innermost than the axillary and than the anterior axillary fold. It is formed by the teres major and latissimus dorsi muscles and its overlying integuments. Now we are done with the anterior and posterior. We can talk about the medial wall. I remember mentioning that medial wall is the wall closer to the body. Now let's look at what forms this medial wall. Now, on the medial wall, don't forget that the medial wall is close to the body, so it's close to the thorax, it's facing the thorax. Now, it is formed by the first to fourth rib of the thoracic wall. Medial wall, first to fourth rib of the thoracic wall, and it is formed by its intercostal muscles and the overlying serratus anterior muscle. That's that of the medial wall. Then lateral wall. Don't forget that lateral is away from the body. So it's literally facing the arm, which is formed by the bone of the humerus. So this lateral wall is formed by the humerus and its intertubercular sulcus muscle. So that's that on the boundaries of the axilla. You can rewatch it again, get the important notes, the muscles, and write them down in your jotter. Now let's go to the contents of the axilla. What can we find in the axilla? What are its contents? I've mentioned it earlier before, but let's look at it one after the other. The first thing we can find is the axillary artery and its branches. We have the axillary vein and its tributaries. We have the lymphatics of the axilla and its lymph nodes. We have the nerves, the axillary nerves. That's that on the content of the axilla. I will write it down shortly. So now let's look at the fourth thing on our list, which is the content of the axilla. We've talked about it before, but I just wanted to do an overview. The first we have are the blood vessels. The blood vessels are found in the axilla. We have the axillary artery and its branches. We have a video on it, an explanatory video on this axillary artery. So please go to our channel and do well to watch. We have the axillary vein and its tributaries. We have axillary lymph nodes. We have the lymphatic vessels. We also have large nerves. Now these large nerves makes up the branches and the cords of the brachial plexus. Now this brachial plexus is another important anatomy topic. It's on our channel, so please still do well to watch it. Now it is important to note that these neurovascular structures I just mentioned are all ensheathed in the axillary sheath. Please note that. Now we are done with the description, shape and size, boundaries, content. Now let's go to the final part, which is the clinicals. Please don't forget that in any anatomy question you're answering, draw. Scribble down something for your lecturer, draw something, it earns you extra mark. Now, now we want to talk about the clinicals, the clinical correlation of this axilla. Please, if you've watched the video till this point, do well to like, drop a comment. If you have any question, please ask, and SmartSpark is always ready to reply. If you have any topic you want us to treat on anatomy, physiology, do well to drop it and we'll learn it together. Back to clinicals. Clinicals, the first clinical we'll talk about is the axillary artery injury. Remember we talked about the axillary artery as one of the contents of the axilla. Now, the axillary artery can be injured in shoulder dislocations or trauma, injury to the axillary artery. The next one we have is injury to the brachial plexus. Remember I talked about the brachial plexus as what forms the large nerves, if I'm not mistaken, yes. Then we also have infection of the lymph nodes of the axilla. These are the three basic clinicals. You can make your research and add more, but I think we'll stop at this. So thank you very much for watching. Keep watching SmartSpark Academy.